The physician pressed his fingers into the flesh just below the ribs. He brought his nose close to the wound and inhaled. Then he sat back, folded his hands, and spoke 3 words no patient ever wanted to hear. A disease. Nothing can be done. That was it. No apology. No second opinion. In ancient Egypt, if your physician said those words, you went home, made your peace with the gods, and waited. But here's what nobody tells you about that moment. The man who just sentenced you was probably right, and the system behind him was more sophisticated than anything the Western world would see for another 1,000 years. So what actually happened when an Egyptian got sick? Who showed up at your door? What did they do to you? And which parts of it would kill you faster than the disease itself? Some of the remedies they used were so revolting that it would be easy to dismiss the whole enterprise. But some of those same physicians were doing things that we now know worked, for reasons they could never have explained. We will get to both. And the man who showed up at your door was probably not who you think he was. Start there. There was no single kind of Egyptian physician. 3 different types of healers could appear at your bedside, and depending on your illness, you might need all 3. The first was the SWNW, roughly translated as physician, a secular practitioner trained in observation and remedy, the closest thing ancient Egypt had to what we would call a doctor today. The second was the Wab priest, usually a priest of Sekhmet, the lion-headed goddess who was simultaneously the deity of disease and of healing. Her priests were considered especially effective against plague and infection. The third was the Sao, the magician exorcist, whose job was to drive out the evil spirits causing the illness in the first place. These were not separate tracks. Often the same man held all 3 titles. A physician who was also a priest of Sekhmet and a certified exorcist was not considered confused. He was considered thorough. The most famous physician in Egyptian history was Imhotep, who lived around 2667 BCE and served as chief physician to the pharaoh Djoser. He was also the architect of the Step Pyramid, also a scribe, also a political advisor. After his death, the Egyptians did not simply honor his memory, they made him a god. Temples were built in his name. People came to pray at his shrines seeking cures. Centuries later, the Greek poet Homer wrote in the Odyssey that Egyptians are more skilled in medicine than any of humankind. He was not being polite. Persian kings sent for Egyptian physicians. Greek doctors eventually traveled to Alexandria to study there, not the other way around. One modern scholar has proposed that instead of taking the Hippocratic Oath, physicians today should take an Imhotepic oath, given that Imhotep lived more than 2,000 years before Hippocrates. But we have not gotten to your illness yet. The physician arrived at your home. Egyptian doctors made house calls. He carried with him the knowledge accumulated in the Per Ankh, the House of Life, a kind of library school attached to the great temples, where medical papyri were copied and studied and passed from one generation to the next. These institutions trained specialists: eye doctors, head doctors, stomach doctors, tooth doctors. The Greek historian Herodotus noted that each physician is a healer of one disease and no more. This degree of specialization existed in 1500 BCE. The examination that followed would not look entirely alien to a modern patient. The physician questioned you about your symptoms. He palpated your body, pressing and feeling along the surface. He brought his nose close to wounds and smelled them, which was useful because septic wounds smell different from clean ones. He checked your pulse. He examined your urine, your excrement, and if you were coughing, your sputum. The medical papyri are full of case descriptions that follow the same pattern. If you examine a man having this, you will say what is wrong with him. He is a man suffering from this. You will treat him with this. His understanding of what caused your illness, however, followed a theory that would seem strange to us. The Ebers Papyrus, written around 1550 BCE and stretching 21 meters in length, describes 22 channels called Me-Too running through the human body. These channels carried blood, air, mucus, semen, and urine. The heart sat at the center of the system. When you fell ill, it was because spirits or supernatural forces were blocking one or more of these channels. The physician's job was to identify the blockage and clear it, using whatever combination of herbs, procedures, and incantations was required. After his examination came the verdict: a disease I will treat, a disease I will contend with, a disease that nothing can be done about. The first meant confidence, the second meant effort, but no guarantees. The third was the sentence. And then, assuming you were in the first two categories, he prescribed the remedy. This is where things become difficult to explain. Stop for a moment and put yourself inside the situation directly. You are a laborer somewhere in the Nile Delta. The year is around 1400 BCE. You wake up with a fever and a swollen jaw, your teeth aching so badly you cannot close your mouth. The physician arrives before noon. He examines you, presses along your jaw, smells your breath, checks the inflammation. Before touching you again, he recites an incantation to Heka, the god of magic and of medicine, asking him to make the treatment effective. Heka carries a staff with 2 serpents coiled around it. His involvement in your treatment is not optional. Without his blessing, no remedy fully works. That is not superstition layered on top of medicine. In Egyptian thinking, they are the same thing. Then he prescribes the remedy. Depending on which papyrus he consulted, that remedy might include the following: excrement. The Ebers papyrus contains a prescription for skin lesions that calls for the excrement of a scribe, mixed with fresh milk and applied as a poultice. Dead mice, ground and incorporated into preparations, appear as topical dressings. Lizard blood shows up in treatment formulas. For a woman suffering from an impaired libido, the prescribed treatment was horse saliva. If you were a woman wanting to know whether you were pregnant, the physician might place an onion inside the vaginal canal and examine your breath the following morning. If your breath smelled of onion, you were with child. The reasoning behind this was internally consistent. Egyptians believed the uterus was a channel running from the lower body upward to the mouth. Wrong, but not arbitrary. If you wanted to know the sex of the child you were carrying, your urine would be poured over 2 sets of seeds, barley and emmer wheat. If barley sprouted first, the child would be male. If emmer sprouted first, female. Modern researchers have actually tested this, and they found that pregnant women's urine does accelerate plant germination compared to non-pregnant women's urine. The sex prediction does not hold up, but the test was detecting something real, even if the interpretation was off. Now, before you write any of this off entirely, consider what else those same papyri prescribe. Honey. Applied to wounds, it worked. We know now that honey is a natural antimicrobial agent, that its chemistry actively inhibits bacterial growth, that it creates an environment hostile to infection. As a wound dressing in a world without antibiotics, it was close to ideal. The Egyptians used it constantly, and they were correct to do so. Willow bark and willow leaves appear throughout Egyptian prescriptions for pain and fever. Willow contains salicylic acid, which is the active compound in aspirin. The remedy for asthma in the Ebers papyrus is a mixture of herbs heated on a brick so the patient can inhale the vapor rising from them. That is a primitive inhaler. The mechanism differs from a modern one, but the principle, getting medicine into the lungs through inhalation, is identical. The green eyeshadow that Egyptians applied around their eyes was made of malachite, which contains copper. Copper is antimicrobial. They were applying antibacterial agents directly to one of the most infection-prone areas of the body in a hot climate full of insects, without any idea why it helped. Perhaps the most quietly astonishing line in any Egyptian medical text is the recommendation in the Ebers papyrus to apply the yeast of sweet beer to open wounds. Alexander Fleming discovered that mold could kill bacteria in 1928. The Egyptians were putting yeast cultures on wounds in 1550 BCE. If that genuinely surprised you, this channel is going to keep doing that to you. Subscribe now, not as a reflex, but because there is a whole category of history that operates exactly like this, stranger and more sophisticated than you expected, sitting right underneath the surface of what you thought you already knew. Now we need to talk about the other medical text, because the two papyri are very different documents, and that difference matters. The Edwin Smith Papyrus, dated around 1600 BCE, contains 48 surgical case studies. There is almost no magic in it. It reads like a clinical manual written by someone who actually wanted to understand what they were looking at. Fractures are described in precise anatomical terms. Treatments include suturing wounds closed, applying splints to broken bones, packing open injuries. There are instructions for draining abscesses, performing amputations, closing wounds of the lip, the throat, and the shoulder. Head injuries are described with enough neurological detail that modern neurosurgeons have studied the document and recognized the observations as accurate. Evidence found on ancient skulls suggests that Egyptian physicians may have attempted to treat cancer. The Edwin Smith Papyrus describes what appear to be tumor cases, and for one type the recommended approach was cauterization, burning away the diseased tissue to prevent it spreading. Whether this intervention succeeded in any individual case is unknown, but the attempt existed. Dental disease was arguably the most universal suffering in ancient Egypt, and it had a cause that was impossible to avoid: bread. Egyptian grain was ground using stone querns that shed particles of grit and sand into every batch of flour. Every loaf of bread contained abrasive material. Every bite slowly wore the enamel of the teeth away. By middle age, many Egyptians had teeth ground down to the pulp, with exposed nerves and chronic abscesses. The Ebers Papyrus contains formulas for dental pain, mouthwashes from celery and bran, preparations for infected gum tissue. Whether any of these provided lasting relief is uncertain. What is certain is that people suffered with their teeth for their entire adult lives, and physicians tried to address it. The world's first dentist on record is a man named Hazi-Ra, who served under Pharaoh Djoser around 2650 BCE. His title was Chief of Dentists and Physicians. His tomb at Saqqara preserves the inscriptions. He treated exactly what the mummies confirm: teeth destroyed by a diet that was nutritious enough to build a civilization and abrasive enough to ruin every mouth in it. One last thing, and this is the one that stays with you. From Thebes, dated to the first millennium BCE, there is a prosthetic big toe, made of wood and leather, shaped to the specific foot of its owner, with articulated joints that allowed it to bend with the foot during walking. When researchers examined it, they found wear consistent with years of actual use. This was not a burial object. Someone walked on that toe, every day, for years, which returns us to the physician and his three verdicts. The Egyptians called medicine the necessary art, not the sacred art, not the divine art, the necessary one. They understood that caring for sick people was not optional, not a luxury that existed only for the wealthy or the powerful. Inscriptions suggest that for at least some Egyptians, medical care was provided without charge. Physicians visited patients at home. Specialists served different parts of the body. A hierarchy of practitioners existed with training institutions behind it, written records behind those, and centuries of accumulated observation behind the records. They were wrong about the channels, wrong about spirits causing disease, wrong about the heart as the seat of thought and emotion, wrong about the uterus reaching to the mouth. But the structure they built around treating sickness, the motion of examining, reasoning, naming, acting, and writing down what you found, that structure is medicine. The specific mechanism they invented to explain disease would eventually be replaced. The approach they used to confront it would persist. It started at the edge of the Nile, in a room that smelled of honey and frankincense, and something considerably less pleasant, where a man trained as physician and priest and exorcist simultaneously pressed his hands against a body in pain and tried to understand what had gone wrong inside it. He was the first person in recorded history to attempt that systematically. He left us the papyri to prove it. And the first thing he ever wrote down, the very first instruction in a tradition of medicine that would eventually reach Greece and Rome, and then everything that came after, was not a prayer or a spell. It was an observation. If you examine a man having this, you will find this, and you will treat him. That sentence, in its basic structure, has not changed in 4,000 years.